Hello, everyone, and welcome back for Season 2 of the Wellness on Purpose podcast. Here at the Wellness on Purpose podcast, we appreciate that there is no linear path along one's wellness journey and understand how easy it can be to get caught up in the latest health trends found on social media. Our intention is to provide you with impactful, educational, and realistic information to help you progress on your journey to live wellness on purpose now and for future generations. Hey guys, it's Marissa here, and welcome back for another episode with an amazing practitioner from the Care Wellness Center in Lindsay. Today we are joined by naturopathic doctor, Dr. Tali Troyansky. Dr. Tali believes that common doesn't necessarily mean normal, and she acts as a health detective to find not just a band-aid approach to your symptoms, but rather what the root cause of your conditions are. She also teaches her patients how to take accountability for their health, how a salad may not be the healthiest option for you, and how you can choose between using natural medicine and conventional medicine along your wellness journey. So without further ado, welcome to the Wellness on Purpose podcast, Dr. Tali.
Thank you for inviting me. I'm excited.
Yeah, I'm really excited for our community to learn about another naturopath that's accessible to them. And what's a little bit more unique for yourself is you're more in the Kawartha Lakes, Lindsay area, but also towards the GTA area. So you do things mostly online, but you're connected with Kawartha Care, which is in Lindsay. And we've interviewed many other of your staff members, and everyone's been great so far. So welcome to the podcast. And we're so excited to feature everyone in your clinic.
Thank you.
So let's just jump right in. And how about you tell our listeners a little bit about yourself, who you are, what your wellness passion is, what you do, and the type of clientele that you support.
Yeah, so I'm a naturopathic doctor. I'm practicing evidence-based medicine, and my passion is to really get to the root cause and help people feel their best self. Something that I say very often is common doesn't mean normal. So it's not necessarily like, you have to have a condition or a disease, but just if you have a symptom, we can always optimize it. We can always improve it. And that's what I thrive for. I work with a lot of women. I do a lot of women's health, hormonal health, digestion, skin health, weight loss, mental health. Those are my main areas. My patient's favorite title for me is the health detective, which I absolutely love. And I really think of a naturopathic doctor as being one because you really want to figure out what is actually going on, considering body as a whole rather than, putting a band-aid on the symptoms. So if you go to your doctor and you say, my tummy aches and I have a headache, they're going to refer you most likely to 2 different specialists. But for me, if you say that, it's like, where's the link? How is that connected? So I love what I do, and it brings me a lot of passion.
That's amazing. And I love that you mentioned, for sure, medical doctors absolutely have their place, but I find upcoming with a lot of different clients that I see and a lot of people that we see at Joanne's place is that they don't just want a bandage approach. They want something that is much more in depth and really allowing the practitioner that they're working with to figure out what is the root cause. So what would be some ways that you would maybe find that out? Do you run different tests? Are you able to run blood work, those types of tests? Or how does that look like from a patient's perspective?
Yeah, so I'm going to tell you a little bit about the process. And before the appointment, I usually send a really detailed intake, which goes system by system. And I go over it before the appointment so that when we meet, we can actually dive deep into everything. We go over it all. History, even, how they were born, how were their menses beforehand, how are they now? All these details are super important, and the appointment is about an hour and a half. And at the end, after all the questions, I say, okay, well, here's what I think is going on. As a naturopathic doctor in Ontario, we do have access to blood work at Life Labs, and I do have access to special testing. And it's really, really easy to use because this is something that can be mailed over, whether it's a hormonal kit or a digestive/stool analysis kit. I do use a lot of these testings because I'm the kind of practitioner that I test, I don't guess. And this has been providing a lot of information that generally you won't be able to get through just general blood work at your medical doctor. So if we do need to do any of that, I usually prescribe that after the first initial. And then once we get the result at the follow-up, it's like, okay, well, here is actually the clear picture. This is what's going on. We're really connecting the dots to everything. It's like a mind map that I'm putting out there, and to be able to understand everything better.
I love that. I'm sure your patients would also really like to see that, because some people only believe exactly what they see. So when there actually is proof on paper, it's really nice to connect those dots and say, your estrogen is high, your progesterone is low, or whatever that might look like, right? So how long of a process is a patient normally with you? I mean, I know it's dependent on what they're going through, but let's say hormonal, if you work mostly with women and hormones, what would that journey look like in the sense of they come and see you, get the tests, kind of get a protocol? At what point can they kind of see changes happening in their health?
I always say that my goal is for them to not need me anymore. And I do practice doctor as a teacher. So I want them to know how to take accountability for their health, so that they're not always, like the little things, so that they'll know what to do. If they had a blood sugar spike, they'll know that they need their fiber and their protein the next day, or their cinnamon tea, or just really teaching them to be able to be independent and taking accountability. But it really, really varies, because hormones, sometimes it takes, adrenal glands like a few months, or if it's PCOS or it's a fertility journey, it really, really depends. But usually I would say 2-3 appointments to maybe really get everything back on track. And then it's as needed basis. Check in with me later. It really, like I said, it really, really depends on the situation. Like I have some people that have a mild GI, like digestive symptoms, and they come to me on the first appointment, and then everything goes well, and they're like, okay, well, I'll just contact you when when everything fails. And I said, okay, that's perfectly fine.
So with your protocols that you provide to patients, obviously they're going to be very unique depending on, their situation, who it is, but do your protocols include supplement, food, lifestyle factors? Like what types of areas are you looking at when you're supporting a patient?
Yes. So as a naturopathic doctor, I use botanical medicine, which is herbs, Chinese medicine, acupuncture. Well, acupuncture I don't really do virtually. Clinical nutrition, diet, lifestyle, physical medicine, and then like supplements, nutraceuticals, and prevention. Like preventative medicine is also something that we excel in. I do provide my patients a schedule. So if I provide them a protocol, I always say, here's how you take it, with like breakfast beforehand. Provide them something that will be feasible for them, because a lot of the times I don't want to just, tell them what to do, but rather work with them and see what is feasible. So if I am giving them supplements or herbs or modifications by any means, this is something that I want to match with their lifestyle.
That's amazing. That's really great, because I think a lot of people get nervous trying a different type of alternative medicine, shall we say, when it may be something they're not familiar with and they don't know if it's accessible for them based on their lifestyle. But knowing that you can adapt to whatever that lifestyle is, whether they work night shifts or they work 12 hours or they don't work it at all, or so on, right? So that's awesome. That's really great. So in your field of work, I know you mentioned that you see a lot of women and hormones, but would you say you're seeing a rise in a common health concern across the board?
Stress.
Yes, that's a big one.
That's a huge, just stress in general, and really, affecting your fertility, affecting the hormones, increasing your insulin resistance, affecting your sleep cycle, digestion, metabolism. It really, like, I think, people think that it's underrated, like, oh, it's just stress, like it's so common, but it really is a big deal, because it does affect your hormones. It does affect every single system in your body. And this is something that sometimes the body is so used to, and you don't feel like this is a big health concern until you're in that drive and something happens, and then you snap out of it and say, okay, well, this is something that needs to be taken care of. And then once you start feeling good again, you realize how much of that stress you were holding in, and how much it really affected your hormones, your skin, your gut, everything.
Yes, stress is a huge one. Maybe people at the beginning of the pandemic felt stressed because they were stressed of the unknown. But do you find that a lot of people were at a state of stress, but is no longer at a state of stress because their schedule kind of, let go, they realized what was most important in their life, those types of things? Or do you feel that people are still at a very stressful state right now, just with everything still going on in the world?
I feel like it's an all or nothing situation, like really black and white. I think from my patients personally, some of the patients really realize what's important. They're getting more into nature, and especially those who have been with me for a while, they, I've kind of provided them with the tools of what you need to actually focus on, because you need to use every situation in your favor. If you have the time, go out in nature, spend time with your family, work on your health, work on your diet. If you're not, if you're working less, meal prep more. But I do find that a lot of other patients, especially now, that are joining and seeking help, is a lot for stress and anxiety and hormones imbalances. I think that it's still affecting many people. And whether it's the pandemic or being scared of the unknown, that is definitely heightened everything else that was going prior to.
Yes, for sure. So for our listeners right now, what would be some ways that they could assess their life right now to know whether or not they're under a state of stress? Like, what would be maybe some symptoms or some cues in their lifestyle or their routine or habits that they could say, okay, maybe I am under a state of stress?
It really varies from person to person. Stress can be manifested in so many different symptoms, but I would say the general ones that I see are bloating, gas, or with hormones, just a heavier period or an absent period or irregular cycles, acne, anxiety, right? So palpitations, feeling more tense, headaches, skin that is breaking out, more joint pain and inflammation could come as others, right? Because when we have the high cortisol, that is definitely increasing our inflammation. That is also something that would affect our blood sugars and our fasting insulin. And this is just, I think for every patient is so different. And I always say, you don't necessarily have to have a symptoms. If nothing is wrong and you want to optimize your health, you can definitely reach out someone like a naturopath or a nutritionist or someone who will guide you there. Just because, like I said previously, you don't have to have a specific diagnosis if you want to feel better. There's nothing wrong with wanting to feel better and wanting to feel optimal. If you're a runner or if you're an athlete and you want to do more, great. If you have a high demand job and you want to focus more, great. There is a lot of herbs that we can use for that. And if you go the conventional route, they're more like, if something is wrong with you, here is a medication, which is a totally different field and principle from us. So this is something that I love helping my patients with, explaining how to work their lifestyle in their favor.
And did you always think that you were going to be in this field of work? Like, where did naturopathic medicine come for you? Is there a background from a family member, or is this just something that kind of crossed your path?
So I actually used to be a competitive dancer for many, many years, since I was 4, and I did all the genres. And then when I stopped in my teen years, I had an eating disorder. The only thing that really helped me was when my parents brought me to a holistic doctor. That was back in Israel. So it's something that really helped me. And funny enough, I always knew that I wanted to be a doctor. And I always had this feeling that I want to give people food. Like, I want to tell people what to eat, but I want to be a doctor. And then I discovered what naturopathic medicine was all about. And that was the moment when I was like, okay, this is exactly what I want to do. And because of my, eating disorder background, it really allows me to understand women who has a struggle with eating, and they don't necessarily have to have an eating disorder, just an unhealthy relationship with food, which I think a lot of people have nowadays. So this is something that, happened to me, but I see it in the most beautiful, positive light.
That's amazing. That's so great. So how many years did you dance? Sorry, from 4 till...
I would say 16 years old.
16 years old, yeah. And do you feel that the eating disorder was a reflection of a dancer lifestyle and the demand of having to keep up to certain levels as a dancer, or do you think it came from other aspects in your life?
I honestly still don't know where exactly it came from. I mean, I have been surrounded by really fit people, and I was really fit myself. I was never overweight. I was fairly muscular my whole life because of dancing. I think it was just mostly mental, and it's about the pressure they're putting on themselves. I think it's mostly magazines and like inspirations and all of that, surrounding. But for sure, being a dancer, you have a really like fit, healthy environment around you. And not going to lie, like I remember even back in the day, some of my teachers, my dancing teachers, they told me, oh, you need to lose like, a couple pounds, like a couple kilos before the competition. I think you'll do better. You have a little bit of a belly. And like, I did not have that. They're just very strict like that. So maybe on some level it was from there, but I definitely think that it's, the teen years and like all these like journals and like magazines and expectations around it.
Yes. And definitely now I find more women that I'm talking to struggle with some type of disordered eating, whether it's that perfectionism of orthorexia or the calorie counting. Like there's just so many things that are, I think when people think eating disorder, they only think anorexic and bulimia. That's like the first thing that people think of. But any type of unhealthy relationship with food is really classified under that eating disorder. And there's so many influences, social media, other inspirational things like magazines and things that you were talking about. The pressure is high. And I think that there's a lot of people trying to bring across more body positivity, and a lot of practitioners really focusing on just developing a healthy relationship with food that's less restrictive, less protocol based on, I mean, yes, there are certain things and certain health concerns that, you want to avoid inflammatory foods. You want to avoid certain things that are going to cause havoc in your digestion. But creating that healthy relationship without so many restrictions on what you can and cannot have.
Yes, for sure. I definitely agree. This is something that I focus on a lot because women would come to me, I'm already doing keto and I'm already doing this and I'm already doing that and I've tried it all. And I say, but you did not need to. And I just to touch on that topic, I don't think that there is, one diet for many people. I think every single person needs to have their own individualizations. And this is exactly what's going on behind the scenes when I'm talking to my patients. You don't need to exclude these foods just because it worked for someone else. Your body doesn't need that.
Absolutely, for sure. And like, I'm sure you've talked to your patients about this, and I try to stress with my clients about this too, is you could have the most perfect diet. You could eat the salad, you could have the smoothie, you could have, the perfect bowls. But if you're not in a state of happiness and your body's under a state of stress, your digestive system is bad, it doesn't matter what you eat. Like it doesn't matter what you're consuming, if you're not connecting the emotional factor to your food and your body as well.
I absolutely agree. And sometimes, just knowing that, okay, for example, like broccoli is healthy, a salad is healthy, it might not be necessarily healthy for you, like not just emotionally, but also physically. That's why you really want that individualization. But I definitely agree with you.
Awesome. So being a naturopath, I mean, you see many different clients. You probably are always invested in different research and what's new and things like that. You probably get a lot of information that maybe isn't necessarily true. So is there a myth that we can debunk on the episode today regarding naturopathic medicine?
I think one of the biggest myths about naturopathic medicine is coming from potentially the patients thinking that they have to choose between natural medicine and conventional medicine. And this isn't true at all. In fact, naturopathic medicine can be complementary to you. So if you are already on medications and you need more support, this is something that we can help with. Whether your goal is to stay on medications, to get rid of medications, or to just lower your dose, or to optimize whatever your health goal is, you definitely do not have to choose between us and conventional medicine. I actually work with many medical doctors. I talk back and forth with them in terms of prescription, like if they're on a diabetes drug or a high blood pressure drug, and I give them something and I don't want to lower their blood sugars or the blood pressure too much. This is something that I talk to their medical doctor about. And I think that the other biggest myth is evidence. So a lot of people still think that naturopathic medicine is the same as homeopathic medicine. And even though homeopathic medicine is very like, a very little practice that some naturopathic doctors have, doesn't mean that it's definitely not the same. And there is actually a lot of research-based evidence. So this is something that I love talking to my patients about. If I'm giving them something, this is what research has said. This is the dosage that worked. This is why we're doing it. This is what I'm expecting it to do in your body. It's never just me, deciding from the top of my head what I think is going to work. It's always evidence-based research. And sometimes they ask me for those research papers and I love sending it. This is such a developing field. There's so much research going on right now because I think more and more people are realizing that this is the way, this is the lifestyle, this is the prevention.
Yeah, absolutely. For sure. The prevention as well as like how you can support your conditions now without having to go on drugs. Or if you do, is there something that's more natural that can support it that will lessen the side effects of the drugs as well too?
Exactly. Even just blood work, like they would come to me and they would say, you know what, like my doctor said everything is normal. And I said, but normal doesn't mean optimal. Just because it's within range doesn't mean that you're not going a certain pattern. For them, they're going to tell you to come back when it's going to be high or really low. That's when they can prescribe you something. But we don't have to wait for that moment. We can actually prevent that or slow the progression, whether it's cholesterol, whether it's blood sugars, whether it's hormones. We don't necessarily have to wait until something is out of range, and prevention is really key.
Yeah, that's fantastic. That's great. So as a naturopathic doctor, and you're obviously recommending different lifestyle factors and supplements and diet protocols to people, but what are some things that you have in your routine that are tried and true that you do every single day?
Something that is definitely a non-negotiable for me is as soon as I wake up, a big glass of warm water with lemon. I have been loving morning walks outside for about an hour, just, moving my body and then coming back, taking my supplements and then having my breakfast and doing a little bit of a meditation, just preparing for my day. I think this is one of the biggest things that really made a big change for me this summer. And I mean, I've always been doing something very similar, but I think the sunshine and really having that routine constantly, I've been really trying to wake up at the same time every day to really push my circadian rhythm back into place.
Yeah, I love that you mentioned the circadian rhythm because I find that people that I'm talking to, first off, either don't even know what the circadian rhythm is, or if they're aware of what it is, they know that their regular routine is not regular anymore. So can you kind of talk to our listeners a little bit about what the circadian rhythm is and why it is important to know how to regulate that in one's wellness journey?
Yeah, so the circadian rhythm is basically your biological clock. It's your sleep and wake cycle, and it's really important because this is something that's going to be affecting your sleep cycle, like your sleep, but also how awake you feel during the day. It really aligns with the hours, like with the sunrise and the sunset outside. And I often find that when we are stressed, and especially during the pandemic, people have been going to sleep much, much later, waking up much later, and that has definitely been messing up with their sleep-wake cycle. And something like one of the easiest tips to recommend is really like just to bring it back to balance a little bit. Wake up and go to sleep at the same time. Get yourself outside to look at some sun in the morning as soon as you wake up. This is really going to be telling your body that, okay, like I'm awake right now. You need to wake up. You need to respond. You need to be ready for the rest of the day and the rest of the hormonal mechanisms that need to happen.
Yes. And especially right now, like I woke up early this morning and I went outside and it's like starting to get that like chill in the morning, like a little bit chilly, but the sunrise is just so beautiful and it's so bright. So if you're not already in a routine of getting up and going for a walk, or even just getting up and going outside and letting the sunshine hit your face, you should be doing that. Especially right now, I find September is like that perfect transitional month where people want to, start fresh and put some new goals in. So morning sunshine would be a great one for everyone that's listening right now to do.
Definitely.
So along your journey, would you say that there is anyone or anything that's been a really big inspiration to your practice as a naturopathic doctor?
I think there are many great influencers out there that I take a little bit of, a little bit from and learn. However, I would say that my family is the biggest inspiration. So I grew up in the house where fruits and vegetables were part of every meal, and I wouldn't be able to, leave the table unless I finished with those. And Mediterranean diet was something that we still practice. And I would say even my dad has been one of the biggest inspirations. So he's the guy that will wake up at 5 a.m. before work to go to the gym and train, and would come back after work tired and still do the walks, and would like prepare his juices and smoothies. And I think that's been so inspiring. I think that just having a family that really into health and fitness gives me that motivation and pushes me. Just looking at my parents, especially, like I'm just in awe.
That's so amazing. I love when people talk about their families on the podcast, because there's so much out there on social media that can be an influence to you in a positive way. But it's so lovely when we can come back to our roots and like that traditional, right from the get-go kind of inspiration from you when you're a kid. So that's amazing. That's great.
Yeah.
And I think developing those wellness routines that's been influenced to you at such a young age just allows it to kind of come natural more to you to want to make those healthy changes, right?
Exactly. Yes.
That's awesome. So along your journey, would you say that there has been like one go-to product that you use, or maybe that you recommend on a regular basis to support one's health and wellness?
In terms of me specifically, I have been loving collagen, especially in the last, I've been using it daily in the last half a year, because I think for me, just having a busy schedule, I can just add it to my soup on the go or when I'm in the clinic in between patients. I love how it has so many benefits for the skin and for the gut. And then having a little bit of protein just gives me like a boost up in the energy, and then helps balance my blood sugars in the meal. So just something that I've been loving.
Yeah.
Other than all the supplements that I am actually taking.
Collagen is amazing. I think a couple other people on the podcast have also talked about collagen, but some people think, is it worth the hype? Is it really, do I really, really need it in your routine? And I say, well, is it something that you want to look and address as adding more protein into your diet without having to necessarily have an entire smoothie or shake or take another like supplement form? And, do you want to improve when you increase your protein intake, then you're also supporting, hair, skin, nail growth, recovery, and things like that. So I also am a huge fan of collagen too. Some brands that, we have at the store, which I'm sure you're familiar with, is like the NACA, we've got Organica, Cytomatrix, which is my personal favorite. They have a variety of different types of collagen. We also have the Total Body Collagen by Assured too. That's a really popular one. But yeah, collagen is like a really easy thing to add into your routine. I add it personally into my morning coffee, and I find that a lot of people do that in the morning. Is there any time that you would say you shouldn't take collagen, like during the day, like at nighttime versus morning? Like, do you think that there's any issue taking it at any time?
Personally, no, I'm not a coffee drinker. I usually add it into my chia seed pudding or into my overnight oats, or I love just adding it into the soup, because sometimes I'm really busy to actually have like a solid meal. So I would be sipping on soup, and I just love how it dissolves and then there is no taste. So that's personally a really great option for me when I'm looking for protein and I don't have the time to prepare it. And there it is.
Yeah, soup is like perfect. We're kind of getting into that soup season. Yesterday when I was at the grocery store, I bought like butternut squash and acorn squash. And I was like, it's starting to be soup season, I find, at least. Maybe I'm jumping ahead of the game.
Yeah, no, it definitely is. You start wanting the more cozy comfort foods.
Yeah, for sure. That's awesome. Okay, so this is our last question for you. And for our listeners, is probably one of the favorite questions that we ask on the podcast is, if you were stuck in an elevator or in a room and you had the opportunity to support somebody and inspire them to progress along their wellness journey, what would be a piece of wellness advice that you could give to them that they could implement into their lifestyle starting today?
To go see a naturopathic doctor who would give them a rather more tailored and individualized approach.
I love that.
honestly, the biggest things are like move your body daily, get some good sleep and water and whole food diet. And otherwise supplements are just like a supplement on top, right? To supplement something on top. And there's nothing that we can do to fix if the basics aren't taken place. And again, just go see a naturopathic doctor. This is something that they'll help you with.
Yeah, that's amazing. So for sure, the basics, we want to look at sleep routine. We want to make sure we're eating whole foods, drinking lots of water, moving the body. And then once you are aware of those foundational pieces and things are still maybe not going as regular, or you're not feeling as optimal as you should be, get in touch with a naturopath, because they can do a little bit more extensive testing, you know, test the blood, test the stool, the hormones and things to get you a little bit more answers to maybe what's going on.
Yeah. Or if you're having trouble with just the basics and don't really know how to proceed with the basics or what they really are, what's optimal for you, this is also something that we help with.
That's awesome. I love all of that advice. And I will tag and let you guys know how you can get in touch with Dr. Tali to support your journey to optimizing your wellness. So thank you so much for being on the podcast today. I appreciate it. Joanne's place appreciates taking the time. And I'm sure our listeners are going to be in touch. And thank you for all of this information as well.
This was so lovely. Thank you so much for having me.
You're welcome. Thank you guys so much for tuning in. Please be sure to like, subscribe, comment, and share on social media that you're listening to the Wellness on Purpose podcast.